The topics discussed during this podcast can be triggering and upsetting to some viewers, seeing as on the show we discuss a wide variety of distressing material. Each episode will vary, with the topic stated in the title. We use adult language, therefore parental guidance is advised. Although situations that are discussed can be unpleasant and frankly quite scary, we are using them to educate ourselves and others. Hi, I'm Alex. I'm a 19-year-old second-year psychology student.
Hi, I'm Patrick. I'm also 19 and I'm a second-year physics student.
Welcome to the Move to the Left podcast. This week we're covering women. The topics we want to discuss include a range of problems, and we have two different sides to the issues, seeing as I may have had first-hand experience with everything that we'll discuss, and Patrick has a viewpoint of a bystander.
Well, and also I will admit sometimes I've done things wrong.
And
yeah, it's quite difficult when you sort of realise that you've done stuff wrong as well.
And
because obviously, like, I personally have never had like negative intentions. You know what I'm like? I'm like an annoying hippie, peace and love, all good vibes. And yeah, I think it's quite important that men are more educated on sort of the impact of what they do and stuff. So there'll be an aspect of that as well.
yeah. So firstly, I want to touch upon the term teach your daughter to defend herself. It shouldn't be like that. It is teach your son to respect people, teach your son not to be a rapist, not to abuse women, and not to see themselves as better or superior, you know. That's not to say that girls shouldn't know things, but it's also the fact that if you educate your children, they'll...
Yeah, well, I've literally just got back from doing safeguarding training where I work, and I think there should be safeguarding done at schools, because I did actually do safeguarding training at college, but that's only because I was a member of the student union and I had lots of students who would talk to me, so I had to know what to do if there was an issue. But when you look at a lot of like things that not I've experienced but I've witnessed, is that it starts off as something very, very innocent and someone with literally no negative intentions at all, and it develops into something worse, and that would stop and that wouldn't happen if people were educated and if people knew that actually these different things could have a negative impact, because it is a lot of stuff that is seemingly, you know, a teacher giving a child a hug could be the start of a child then you know, wanting more hugs, wanting more affection. That can lead to something wrong, even though obviously there is nothing, you know, a child maybe did really well at a football game and the teacher who's also their coach gave them a hug to say well done, and obviously like they've not done anything wrong there, but it can lead to something, and just purely knowing that that can lead to something can stop it. Yeah,
I had a level 2 counselling course in college, and one of the main things that we were taught is to never give your patients a hug, because you dampen that barrier between patient and psychologist or counsellor or whatever, and you can't go on that actually.
And yeah, I think that just shows that obviously they say, you know, it's to do with teaching your daughter, whatever. It is just to do with teaching men. Well, no, it's to do with teaching everyone, because obviously girls can do things wrong, so can boys.
Of course, yeah.
So can women, so can men. So it's education altogether, but obviously most of it is directed towards women, so that's why it's often the rhetoric is teach the man, or no, teach the daughter, when really it should be just teach everyone, you know, to be respectful.
Yeah. So I also want to touch upon the fact that don't teach your daughter or whoever is in your life that's a young girl that if a boy is being mean to her, he likes her. You know, it's not
actually
right.
To be fair, I remember being a kid and having it the other way, and having teachers say to me that girls are doing stuff because they like me. But obviously it's fucking just a load of crap, isn't it? It's just ridiculous.
Kids are little shit sometimes, you know. It's not to say that they're bullying someone else because they like them.
That plays into, you know, when people say about this is a bit of a sidetrack, but you know, when people say like, oh, don't teach my children about gay sex, you know, because they're too young to learn it, but then they're straight away going, oh, you know, this is two kids, oh, that that boy is doing it because he fancies her. Do you know what I mean?
Or like the whole don't push homosexuality onto my child and then go, is that your girlfriend?
Yeah, exactly. So they're just straight up just doing that stupid hypocritical thing.
Pat, what did you want to say about what you saw the other day about how men treat women?
I mean, so I'm gonna put a bit of backstory here. So where I've mentioned this like every time we've spoken, but where my dad wasn't around, I grew up with mostly women, and that I think that led to me picking up a lot more of what went on around me, and it's just like little things like there are so many guys that will just sit there and sort of like touch up a girl and just not think anything of it.
Yeah.
And I think it's bizarre that it's such a sort of, because like the other day one of my I know someone who was hanging out with someone and they were like, oh yeah, he was like touching me up, saying it to a girl, and then they were like, yeah, I know, he just does that. And it's like, what? He just does
it's
that.
how normalised it is, and the fact that there's no consequences for that.
And I think it's difficult as well though, because there does deserve to be consequences, but like, if someone stops and genuinely becomes a better person, changes, it shouldn't like stop their future and their So it is a really difficult, because obviously if someone's done something really bad, then it should. But if it's like you're young, you know, you're a teenager, and because you are still learning, really, aren't you? And it's such a difficult it's such a difficult thing to navigate, really, because there's always going to be people that will disagree with you, and it is something that people will be so passionate about. Like in terms of racism, it's like, you know, obviously there's different cultures and whatever, and different people will feel more passionate about it than others. Even when you see when black people stand up and say, well, no, that doesn't really happen, and then all of the racist people flock to them. Do you know what I mean? And
I've seen that a lot.
Yeah, it's so difficult to navigate these kind of difficult conversations and these difficult topics, because it's like, you know, like Boris Johnson, he's Prime Minister, and he was like very openly racist, and it's like, if he turned around and he acknowledged that and he really changed, then he would deserve it. But I don't think he deserves it because of just how horrible he was, and I think that should be the same with most things. But then when it comes to this topic and men treating women badly, like sort of at what point is it that you need to say, right, like, you're cancelled? Do you know?
Yeah. This whole like cancel culture, obviously we're seeing a lot of that online right now.
Yeah, like Shane Dawson
and Jeffree Star. Oh, careful.
Yeah.
Might need to bleep that out just in case they send us like a
lawsuit. Because I don't think that cancel culture is the right way to do it.
No,
because straight away, I 100% I can tell you that they're going to be suicidal right now, because they have a whole group attacking them.
But what do they do to James Charles? Do you know what I mean? It's like they nearly drove him to suicide just to get rid of a competitor, which is literally what Shane said. All right, so the UK. I want to touch upon girls' periods in the UK first. Girls obviously know about their periods, and they know what they are, albeit not to the full extent. And they, like, sanitary products are widely available, but we obviously have to pay for them. What is the case of women and teenagers who can't afford them? So we have homeless people, we have people who don't have enough income, people who can, you know, people on like free school meals and stuff, refugees, all these people that rely on, say, benefits or something, or free school meals to feed their families, you know, they're working for minimum wage and they're the only person working in that family. What about the girls who take care of young carers, you know? And this isn't to say that only girls have periods. But this is an episode on women, so I will be referring to periods in the sense of a woman, but I do want to iterate that not only women have periods, in the sense of
gender identity.
Yes, stuff. Which we'll be covering as well. So, right, so feminine hygiene products are a ridiculous price. Ridiculous. I mean, I know that my like a box of tampons is something like £4 for 20. You know, that will last me 2 days. Personally,
if I've ever been asked to get them, I'm always like, what? Like,
Yeah.
this must be a joke.
Yeah. And that is because of the tampon tax. And that has only recently been agreed to be taken off. The fact that it was even a thing in the first place, it's a 5% luxury tax, it's called. Because it is apparently a luxury to have.
So it's like what you would get on shoes and stuff.
Yeah. It's apparently a luxury to have resources to take care of something that you didn't ask for.
It's like putting a bed and, I don't know, a car in the same category. It's just not comparable, is it?
So, with a more in-depth definition, tampon tax is feminine hygiene products being subjected to value-added tax or sales tax, also luxury tax, unlike other products that are considered basic necessities that are tax exempt. This is like men's razors, men's shaving cream. I mean, a women's shaving cream, I saw this, and this was at, and I don't want to name and shame at all, but I saw it in one of those health and beauty stores. A women's shaving cream was £3 and a men's was £1.
I mean, that could play into the fact that men literally don't give a shit what they put on their face half the time.
It could, but it's
I'm going to make the assumption that's not the case.
It's not, no. And even things like women's razors, like more blunt sometimes. Like I know.
Yeah, I know most women use
men's razor. Yeah. Men's razors. So I want to touch upon this like availability of feminine hygiene products to girls, at least in the UK, and my experience with it. My uni has actually started to do like baskets in the women's toilets, where we have tampons, we have pads, we have like a whole range of sizes and everything, and they also give free condoms to go with it. I don't know if yours does that.
I wouldn't know. Obviously, there's nothing that
was there no like news in the uni? Because there might have been.
It wouldn't surprise me if it was something they already had, because they're quite a like forward-thinking uni. But there's nothing I know of. But obviously, that's just because I've never looked into it.
Yeah. Okay. And I also wanted to mention that my college used to do that as well. They kind of started as I left, and there was just a basket in the girls' toilets where there'd be pads, tampons, and that was all that wasn't college. And you could actually put your own in as well.
I'm pretty sure mine did that.
Yeah, if you had too much, or if you were at the end of your period and you didn't quite need it, you'd give it to someone indeed.
Do that as well,
yeah, exactly.
Really quite a lot of, I know schools will have it in the staff room and things like that.
Yeah, I don't think it should be like we have those dispensers in public toilets. I don't think it should be something that we also have to pay for, It's not your fault if your period comes a day early, a day late.
And like I've been with, just out and about with girls, and like when their friends will run up to them and be like, "Oh, have you got one? Because I don't want to go and buy it." Like, do you know? It's just that shouldn't be the way that they have to deal with it.
Exactly.
Because it's sort of, it's like if you ran into a shop and you were like, "I need a plaster." If they had some, they'd probably just give you one. But like, why isn't it the same with a tampon?
And at our school, I know that there was, I think, 3 instances where I forgot, or I just didn't like calculate when my period was coming, and I had to ask the medical person for it. I don't know how to refer to them, and they'd give me like a towel, not like an actual towel. It's called a towel, but it's not even like a proper pad, So that wouldn't, and this is a bit TMI, but it wouldn't absorb anything, and I'd have to like go home and get changed. I can't tell you the amount of times I had to go home and get changed because of it. Regardless, I wanted to say that everywhere around the whole world, same in America, same in any country, is the fact that we are given an education about it, but it's made out to be too scientific, in the sense of not all children, or however old you are, when you learn about menstruation, you don't know.
Well, to the point that it seems intimidating, doesn't it?
Exactly, and I don't want periods and menstruation and all that to be treated like taboo, It's like it's something you can't talk about. Personally, in terms of education, I didn't know what a period was or what the menstruation cycle was until I actually researched it myself. I used an app to help me track my cycle, and that app actually gave me the education that my school should have. You know, in school, sex education was how to put a condom on for 20 minutes, you know? You
I
remember?
remember it being part of the biology curriculum because there was a chance it would come up on the GCSE. I remember I was so bad at it that I just went, fuck it, I'm not going to revise this and just hope it doesn't come up. I was lucky enough that it didn't. But I shouldn't have been in a position where I could go, whatever, I'm not going to learn about that.
Yeah.
Because it's something I should know about because everybody is related to women.
I don't know what your lessons were like about menstruation and the menstruation cycle, but mine was a male teacher reading out of a book, word for word, not even looking at the class. Yes, it was one of the older male teachers as well, and you know, it was literally word for word reading out of a book, and that's all I knew. You know,
because obviously there was the sex education that was purely sex education. Then there was a part that was part of biology.
But sorry, can I just interrupt? Did you even think that sex education actually gave you anything? The first 3 of the 4 lessons were drawing an outline of one of the people there and adding hair, where most of us had already gone through puberty, you know?
Yeah, no, the sex education is completely wrong. They need to talk about things like men and like, because obviously both male and female get urges, but it's a lot stronger for men. And not once while learning about sex did anyone turn around to the group of guys and go, you will get these urges, but you need to control it properly.
Exactly, it's the education.
And literally just saying that could have made such a difference.
And I don't think that they should be divided by gender at all.
I think they should initially, and then sort of ease into it, because I think, you know how younger people act, they will act up.
Of course.
So I think just to break the ice, maybe split.
Maybe.
And then...
But I do think there should be like a no-nonsense teacher, let's say, that teaches you.
No, it shouldn't be. It should never be a teacher from the school. It should be a third party.
I think so.
Everything, because you can't really discuss something like that with kids when you know them.
Yeah.
Because they will take the piss.
Exactly. But I don't think that they should be separated, because if you're learning about these new urges that you're feeling and all this sex and all menstruation and whatever, I think you should be with women, especially from the teach your son's perspective. Because if they're learning,
it does almost give it like context, doesn't it?
If they're learning about respecting women and the women are sat next to them, do you really think they're going to be there giggling? I know, like, some of the people we went to school with, I couldn't really imagine sitting in a...
that would, though.
Yeah, I couldn't imagine sitting in a classroom with them, because I know that they'd be rude and they'd laugh about.
But maybe they
things.
Wouldn't have been if it was done
at that age. But if it was changed, yeah, I mean, they're amazing people now, you know. But yeah, we were all kids, you know.
Yeah, maybe they would have been different kids back then.
And there was the whole thing of like giggling when we had the whole how to put a condom on for the last lesson. But even that, our teacher spoke for so long that we had a 5-minute thing.
The people teaching it usually find it a bit funny as well.
Exactly, so that's not really good. Have some like
because we're not gonna. And even when they start doing sex education, in like year 4 or whenever it is you first do it, it's bizarre because they make such a big thing about it that no wonder there's such a taboo around things like periods and whatever, because the teachers, when they're teaching it, it just needs to be sort of merged into education like everything, you know, treat it like a maths lesson, just sit there and talk about it, and then there won't be this stupid taboo around it.
Precisely, yeah. I wanted to move on to periods in Africa right now and period poverty. So, what it is, it's obviously period poverty doesn't just exist in Africa. Like I said, you know, here people might not be able to afford these products and stuff. But, you know, needing the facilities to have a shame-free and a sanitary and you know, like a personal experience with that period is you need the facilities for that. But obviously people in Africa or girls in Africa don't always have that. actually 1 in 10 girls in Africa will miss school because of their period, because of that shame, because, you know, they don't know what it is. There's a lack of education as well about it.
Well, you know, actually, one thing, just going back to education, and I know this is quite prevalent in African, like a lot less developed places. The idea of the hymen breaking and the blood from that.
Yeah.
Because obviously it can heal and break multiple times, but or it can break when you're riding a horse and it won't heal. And there's a real thing in even England, but especially third world countries, about how that girls will get sort of not like treated unfairly because say they're a virgin, they're having sex for the first time, and the hymen doesn't break because either the person's dick is too small, or it's already happened in because you can do it, you know, riding a motorbike or whatever.
Yeah.
And I think that's an important part of the education. Obviously, it's not the same as periods, but
it's removing the stigma.
Yeah.
It definitely is, and obviously there's the whole aspect of female genital mutilation as well. But that's a whole different topic, you know, that we're not going to be covering today. But no girl or woman or anyone should be held back because of their period, you know. So actually, Action Aid works with girls around the world, and they, through donations and, you know, sponsoring a child, they'll distribute sanitary kits to them. So that has like some baby wipes, it has some pads, some tampons, you know. And especially now during the coronavirus pandemic, they're also helping with that, and periods during the pandemic, you know. And they're not only helping in Africa, but here as well. I mean, the other day I was actually going to the shops and someone they're not homeless, but they were asking for money for rent, you know, because of how much unemployment has been gone down now and not everyone getting furloughed, blah, blah, blah. But going back to this is I think that everyone should educate themselves on period poverty, and maybe if you have enough money, sponsor a child. I think it's 65p a day. It can be a one-off time, it can be multiple times, but I do think that you should definitely educate.
And it shouldn't be down to individual citizens, should it, to do stuff like this? There should be stuff set up where, because I know, obviously, you know, the British government is there for Britain, blah, 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 but we are in a very fortunate position, a very fortunate country where we could afford to not only provide it to people in poverty in our country, but we could also support people in poverty in different countries, and there's no reason not to. It's just, it's just stupid.
Exactly, and the thing is, ActionAid also works with boys, schools, governments to educate about period poverty and to end it as well. I also wanted to touch on that thing that I said about girls missing school. Missing days at school could mean that, especially in Africa, these are the statistics from there, and especially in Rwanda, they can drop out altogether even if they miss a day of school. But that puts them at risk of child marriage and having children really early, and, you know, not having that education just because of a period happening one day.
In general, school is such a valued and important thing over there, because there are you see the things on Children Need and whatnot of them walking just miles and miles to get there.
Yeah, and that's what they do because of how valued it is there. But we have the luxury and the privilege of going, oh, I can't be bothered to go to school today. I mean, I am guilty of this myself. Like, even last uni year, like, oh, I can't be bothered to go in today. Oh, the PowerPoint's going to be up, you know, I can catch up. Okay, so also wanted to touch about how period poverty can be a very big thing in America. Not to exclude them, you know, but I feel like the UK and America may have very similar experiences.
Yeah.
In the sense of, you know, period products are widely available, but at a ridiculous charge or not widely available to some people.
Like, if you say about it in Africa, people won't question it. They'll be like, oh yeah, you know, but if you say about it in England, they're like, well, surely not, you know.
Yeah. So I just want to reiterate the fact that it's Action Aid that do this, and you can go on their website and sponsor a child and stuff, but the links to their website will be given as well. Moving on to Planned Parenthood. Do you know anything about Planned Parenthood?
I know that very far right wing people go and shout at the buildings of Planned
Yeah.
Parenthood.
So Planned Parenthood are a non-profit organisation, and they produce reproductive healthcare in the United States and actually globally as well. The likelihood of you hearing about them would have been within the USA though.
Yeah.
And obviously, there's a fixation amongst the far right people that they only provide abortions and they kill babies, and there's calls and petitions and movements to defund them and get rid of them, and there's all these protests. And I don't know if you've seen that video of that guy who was pro-life and he was trying to rip up the pro-choice poster. Yeah. So there's a lot of that, and
it's one of those things that is just an evidence of how beautifully ignorant they are about it, because all you need to do is very briefly read their website and you'll see, oh no, they're not baby murderers.
This literally took me 5 minutes to compile everything I'm going to be talking about and how much they do and how much amazing work they do. And I do just want to say, with the far right mentality, I mean, surely if you don't look at what Planned Parenthood that is doing, they're not going to be doing it, right?
Yeah, of course, exactly. You stop testing and you get this coronavirus.
Exactly.
That is the mindset.
If these people who protest outside Planned Parenthood, who shout at women when they say they're literally just going in to get STD tested, and they're being shouted at that they're baby killers, and that they're funding these people, and if they actually took a minute to research it, they'd know that they offer a huge amount of services that I'm going to list now. Well, so they do.
Just one second. If you if you take their standpoint, which is pro-life, you would have thought pro-life would involve things like peace and acceptance and whatnot. Exactly. Because if you're pro-life, you should be pro-people.
Yeah.
But for some reason, screaming and bullying and turning up with I've seen it before. They've just stood outside and blocked the entrance with guns. It's bizarre. And how can you be pro-life and then threaten someone with a gun?
Exactly.
It does genuinely make me want to rip my eyeballs out and just eat them.
Yeah. I mean, all these people, before I go and list what Planned Parenthood did, I just want to mention as well that these people will go there and they'll shout and abuse these women so much that Planned Parenthood have actually had to set up escorts to and from their cars.
Well, and I've seen stuff where they've had to do unmarked buildings and stuff, or they've had to I think I saw something where they had to rent out a hall to avoid the protest.
Exactly.
Just bizarre.
Exactly.
That might not be right, but I think
yeah, exactly. And I've seen heartbreaking videos
but
of this.
The fact that what I just said is believable, even if I'm wrong, the fact it's believable, that's worrying.
Because exactly. And I saw this heartbreaking video of this woman who had just had an abortion. And there was not a reason given for it. You could tell she was distraught about it. She had to have her face covered and an escort with her leading her back to her car.
When you see celebrities and paparazzi,
exactly,
isn't it?
Exactly.
And it's that whole it's like a pack of wolves, isn't it? Just going at this one person.
So, what do Planned Parenthood do? They offer STD testing and treatment. They offer birth control, women exams, and cancer screening, prevention. They do offer abortion, but they also offer hormone therapy and fertility services like IVF and, testing to see if you're infertile.
I wouldn't be here if it was for IVF, so...
Exactly. And they do general healthcare as well. They do long-acting reversible contraception, emergency contraception, breast examinations, cervical cancer screenings, pregnancy testing, pregnancy options counselling. They do prenatal care, testing and treatment for sexually transmitted infections, sex education. They do counselling for those after abortions, and so that's for people who have abortions as a result of rape or something, but also those who
who
have had to have their baby removed because maybe their financial situation isn't right.
It's especially, I know that I've seen it before where people have been quite traumatised because their life was at risk with their child, and then obviously they had to get a abortion.
Yeah.
And then I can't imagine the guilt that especially if it's a child that you wanted. I'm getting quite upset because that breaks my heart, the thought of that. Because I've literally just had a baby born into the family, and I can't imagine what it would be like if the mother was at risk. I'm getting a bit.
Don't worry. Another thing that Planned Parenthood are doing, and don't quote me on this, I did see it somewhere, but they were actually even helping with the COVID testing, so they're not just for abortions.
Well, and apparently they're also for fucking self-defense or whatever at this point.
It's
because
everything.
It's just crazy.
They have to.
It's crazy that a place that is there for medical reasons has to implement security.
I think it's because it's for free. Americans don't like that free healthcare.
Yeah, they don't like free healthcare, that is true.
I do want to say that all these pro-lifers shaming women for having abortions or even going to Planned Parenthood should be ashamed of themselves. If that clump of cells is alive to you and is a human to you, what about those 400,000 children in foster care that need a family and that they're human too? They need your help more than that clump of cells that has no connection to you.
Well, not even that though as well. There's been... I'm in a group on Facebook and it's conservatives getting angry at things that don't exist. It's the funniest group I'm in. And it was a post someone made and they posted it on like some pro-life page and they were like, if this isn't a child to you, then blah, you know, you're a monster, whatever. And the guy posted a picture of a dog embryo. And they were all getting like, that's a baby, that's a person, blah blah blah, and he was like, lol, by the way, that's a dog.
Actually, another thing, going along that, you know, that stupidity of people who aren't educated but will petition for these things is, I saw this post of this guy in an anti-vaxxer group, and he posted is it the chemical composition of an apple? Is that what it is? Or something about the apple, what like nutrients it has inside of it, and said, do you want your child to be injected with this? And then everyone's like, absolutely not, I'm an anti-vaxxer this, vaccines that. And he goes, well, I just listed an apple.
Yes, it was the minerals and the different that build up like apple juice essentially or something, wasn't it? It was I remember seeing that. That was beautiful.
Okay, so I would like to talk about Poland right now.
Of course, I have no idea, but you are Polish, so I'm going to be quiet.
So I remember my mum ages ago changed her Facebook profile to like a little black border saying, I support women in Poland or something like that. And it was because of the fact that Poland were trying to ban abortions altogether. And that was ages ago. But they now and recently have tried to ban the aspect of being able to abort a pregnancy within the reason of fetal abnormality. So that's Down syndrome, or the child will be born and suffer their whole life. They've tried to remove that aspect now. Actually,
I do find that as a hard conversation because obviously I work with disabled people,
of course,
and it would break my heart to think that any of them could have not been born
because of that. But the thing is, you know, I don't agree with it. I think
it depends on the level of risk, and at the end of the day, I would be hypocritical to say that they shouldn't be allowed to do it.
Exactly.
And
I don't think it's right. I don't agree with it. But in the end, that is that woman's body. That is that woman's life.
And to be fair, I have seen the stress that, you know, it's horrible. It's horrible. But I've seen the stress that it can lead to for some families, and it. You know,
and it is also about financial as well.
Exactly.
And we're talking about women not being able to afford that.
If somebody has a disabled child, it will lead to a lot more finance, and it could be enough to sort of break a family. And I think that is obviously important to think about, and it's horrible to have to think about or talk about because the support should be there in the first place, that they don't have to abort the child. But
I mean, abortion in Poland is actually really strict anyway. The only reason you can have an abortion in Poland is if you're in danger as the mother, if it's a case of rape. But even then, someone else decides how intense that rape was, and if you're allowed.
Well, I mean, if you're pregnant, there's quite a clear level of intensity, isn't there?
Or any form of health is in jeopardy, or if the fetus is, and I'm quoting this, irreparably damaged. You know, that despite women protesting, both physically, digitally, you know, petitions being signed, these restrictions on abortion are still being placed, and they're worried because there's so many illegal abortions. Oh, do we pass this bill? Do we not? Because there'll be more. But right now, with these abortion laws in Poland allowing abortion in these cases, there is still more illegal abortions than legal ones. There's between 10,000 and 150,000 of illegal abortions in Poland compared to about 1,000 or 200 or 2,000 legal ones.
It's like when, I can't remember which it is, but it's a Scandinavian country, And because they had a HIV and drug overdose epidemic, they set up safe havens where you're allowed to take drugs under the watch,
Yes.
but you would get support to get off it, and it worked. And it's very evident that making things like this legal, because obviously they're different things, but the whole illegal abortions that are going on is pretty much the same sort of concept, because they're doing it for them, to support themselves, and then obviously a drug addict is doing it to support their addiction, and then they're dying because they're doing it unsafely, and it's the same. I'm sure, I don't know the figures, but I'm sure there's so many deaths because of the illegal abortions, and all it takes is for them to make it legal to stop those deaths. It's bizarre. It's so bizarre to me.
It's this control of women's bodies that, a man doesn't have a say in.
Again, it's that strange thing of culture and of what's it called? When a culture does stuff repetitively, what's the word? Like bonfire night is a tradition. That's it. It's the idea of tradition, and why do we keep these outdated traditions that just don't make sense?
It's that, like, if we stuck to that, I mean, men over here would still be able to beat a woman with a cane the thickness of their thumb.
Exactly.
Okay, let's move on. Would like to now cover the topic of male doctors not believing women, and I phrase it that way but it does extend to female doctors. But I phrase it that way because I've experienced it, and I've done quite a lot of research about it. Women actually wait longer for pain medication than men. They wait longer to be diagnosed with cancer, and they're more likely to have their physical symptoms be ascribed to mental health issues and hypochondria. And they're actually likely to have their heart disease misdiagnosed or become disabled after a stroke, and suffer illnesses ignored or denied by medical professionals. My mum, she was diagnosed with endometriosis, but not before being diagnosed with a cyst on her one of her ovaries, which she was complaining about for 5 or 6 years. Mum, and I'm sure she won't mind me talking about this, Mum had, the cyst was so bad that I'd have to hold my own mother up so she could pass some urine, I remember the first thing she did after her operation is she peed for as long as she could. Just emptied herself out. But Mum wasn't believed for the longest time until she went to a private doctor. The NHS didn't believe my mum at all. They wouldn't do anything about it. And when Mum finally went to a professional doctor, private doctor, that was,
well, that's embarrassing as well, because when you look at the fact that Britain prides itself for its free healthcare,
exactly,
your mum had to turn around to
to a
private
and I don't
one.
know if that's a case of her also being an immigrant.
Yeah, well, I'm not going to mention details, but I had a family member who has disabilities, and they had a issue. I can't remember the name. It's got some long-winded medical name, but it's essentially an issue with nerves up the side of the face and in the brain.
Bell's palsy.
Sorry?
Bell's palsy. I had that as well.
No, something else. It's a really rare thing, but and they just kept saying it was their wisdom teeth. And they did an operation to take out the wisdom teeth that were quite obviously not an issue, because you can see when wisdom teeth are an issue. And then she was like, well, it's still there. And it's purely because they just weren't really listening. Exactly.
Actually, after my mum had this cyst removed, the private doctor found cancer, ovarian cancer. And I do apologise, it's quite hard for me to talk about this, but she went to the NHS because that's what the private doctor said, and they said, no, there's been no cancer cells found. And it's like, all right, then how did the private doctor find them, And it actually took my mum forever, and a lot of testing, telling her that she doesn't have it, with the private testing her she does have it, telling her she does have it, and she actually had to go to Macmillan Cancer Support. Big up. They really helped my mum. And then when they finally pushed for it, the NHS went, oh wait, she actually does have it. Magically, they found
It's
evidence.
Just so upsetting, though, isn't it? Because that's such a stressful experience on its own. Like my stepdad recently, he didn't. They were like 98% sure he didn't have cancer because he had a lump on his neck, and that was still stressful. That 2% chance, and you had someone telling you it was 100% chance.
Exactly. Yeah.
And then,
and I actually, in that sense, I do have to say that the doctor treating her was a male doctor, and he was amazing, and thank you. But it still doesn't change the fact that
it's sort
doctors
of like
don't listen to women.
The whole police idea of, they're not all bad, but blah blah. You know what I mean?
There'll be people not believing. Yeah.
But it's one big system that is bad, and you can have an individual that's good. All that kind of stuff.
My boyfriend's mum, actually, I asked her if she had any negative experiences with doctors, and she actually found that it's female doctors that don't believe her, and not male doctors. But I want to get to my story.
Well, I think just before you go on to that plays back again similar to the whole police thing, because people say, oh, but then why do black police do it? And it's the whole way that the mentality and the way that the underlying biases work.
Yeah.
So it's not, because obviously if you went up to every single woman on the street, 9.9999999 out of 10 of them are going to say, I would never do anything against another woman. I'm a woman. But
then they do.
It's not something they consciously do.
Yeah. So my story, this actually happened 2 months ago. And I might get a bit TMI here, I don't really care. But I suffer with really bad periods, and only now is something being done about it. I am nearly 20 and I have been having periods since I was 10. So it's been a long time. And I finally called the doctor because I'd had enough. I was curling up on the floor. I had to take my medication from my surgery to actually relieve me of the pain. Paracetamol, ibuprofen, nothing was working. I have to take really painful medication, really strong pain medication.
I've heard before girls say, as well, because I think this plays into the whole doctor thing, is that they would just go and they'd say they were bad and they just throw codeine at them and be like, there you go, just take that and piss off.
Yeah, exactly. But I called, obviously there was a pandemic, so I had to call the doctor. And I was referred to the only free doctor, and he was a guy, at my doctor's surgery, and I explained what's happening. And I said, there's a history of endometriosis in my family, because I think my mum's mum might have had something bad as well. And I said, I'm really scared. Can I please be booked in for a scan?
And it's like with stomach issues. It may not be the same issue, but if there's one stomach issue in the family, it passes. I imagine it's similar. I don't know about this.
And I was scared about that. And I said that I'm scared that I might have endometriosis. And he didn't even let me finish my sentence and started interrupting me, obviously.
Putting, oh no, it could be putting ideas into
But what he said is he started to explain to me, no, absolutely not can it be endometriosis. I was like, but these are my pain symptoms. And he said to me, by the end of the phone call, he said, you're not listening to me, but you're talking. And I said, no, you're not listening to me. Anyway, it was a 20-minute phone call where he just mansplained everything to me. But he then proceeded to tell me that I don't want to know if I have endometriosis right now, and explained to me the way that they get rid of endometriosis through keyhole surgery and zapping everything with a laser. He told me that that's how you check to see if you have endometriosis. He told me that to scare me into not asking for a scan.
He essentially did a Trump. You know, with the if you don't test it, it doesn't exist.
Basically, and I was really scared, and then after he just kept mansplaining it to me and mansplaining. My mum was actually with me. And she has had her fair share, obviously, with doctors not believing her. And she had enough.
Well, if your mum's anything like you, you're a bloody fighter. So I wouldn't want to get on the wrong side
obviously,
of her.
I was crying, covered up in pain, so I couldn't quite. But she grabbed the phone off of me. And she said, you're not listening to her. And she just said to him, you are going to give her a scan right now. And, oh my God, magically, he set a scan. But a month later, I still haven't had a letter from it. So I had to really chase up that letter. He did put it in. But
I guess
he
with
put
everything
it.
Going on.
He didn't put no. He
so
did.
It wasn't delayed because of everything going on.
He put me down as a routine appointment, which means non-urgent. So I called, and obviously, I I kind of played a sob story on the receptionist. I said, is there any way? The thing is, though, it was a sob story, yes, but I wasn't in pain. It was, the next day of my period, next month. And she said, well, let me see what I can do. And like that, she found me an appointment in a health centre, not a surgery or a hospital, where actually the Princess Anne Hospital people were there doing like a little open date. And all of a sudden, I had my scan, and okay, I don't have endometriosis, but I have really bad cysts on one of my ovaries.
But that's why everything should be double checked as well. Like, one doctor shouldn't be allowed to make these decisions. I got put, obviously it's a different thing, but I got put on horribly strong medication.
Yeah.
And that really messed me up. And when I spoke to a second doctor from the same GP, she said, I would have never given you that. And obviously, I don't blame the doctor because he thought he was doing what was best for me. He decided that the risk outweighed the good outweighed the risks even. But things should be double checked like that, and it's just terrible because it doesn't take anything more than just reading a quick report and ticking it or crossing it.
Exactly. And speaking of reports and doctors and not having a second opinion, I want to read out a story I saw on Reddit, and I will read it out word for word, but we'll also post the thing I'm reading off of.
I mean, this is anonymous, so for all we know, this is a load of rubbish, but we're going to make the assumption it's true.
And with, like you said, you said earlier that you're not quite sure about that, but the fact that it's believable.
Yeah, exactly. The fact that it's believable is very worrying.
So it says, autopsy doctors of Reddit, what was the biggest revelation you had to a person's death after you carried out the procedure? And there's someone that commented going, I assisted with a post-mortem when I was a student. The female patient had died in her 40s. Her medical history had extensive complaints of abdominal pains. One doctor even referred to her as a hypochondriac. Others commented on her apparent anxiety. When they were doing the autopsy, they opened her abdomen and she had extensive scar tissue and she was absolutely massacred inside from endometriosis. She suffered for decades and never even got referred for a laparoscopy. She didn't have fucking anxiety. She had a medical condition. Like I said, I read that word for word. But the fact that, like I said, might not be true, but it is believable, isn't it?
Well, and the thing is as well, like you look at, like I said earlier, my stepdad went in. They said they're 98% or whatever sure that it was a cancer, and he still got screened for that, and that's a good thing. And obviously, that shows you that there's no reason for them not to scan because they're perfectly able to with that. Like, I'm a physicist. I know how the medical physics stuff works. It's not fucking difficult. Yeah. It's turning on a machine and sitting them in there.
And I can tell you that in my notes, after that phone call with that male doctor, because my mum shouted at him to give me a scan, he did, but I bet he would have put me down as a hypochondriac. Bet you, because the whole time, I was crying over the phone. I was, kind of screaming in pain. It's really bad.
Well, that's not how a hypochondriac even works. So they've quite blatantly misdiagnosed you there, because a hypochondriac is like someone who convinces themselves that they've got it. You were concerned that you could have it. Exactly. You didn't believe that you had it. You believed there was a possibility. And that is not... So if they have put that, then that's blatant just misdiagnosis.
Okay, well, we're at the end now. Can you, as a listener or as just anyone, help any of the things we mentioned today? And you can. You can go through ActionAid and sponsor a child, like I said, for 65p a day, or it's $19.50 a month, I think. If your place of study or work has baskets to take period products for yourself or leave some, please do.
Also, just going to say, if they don't, tell them to fucking
tell them, tell them, talk to your student union.
No one's going to say no to that, are they? There's no reason not to, because it's just a basket in a room.
If you're at the end of your period or you don't get periods anymore for whatever reason, like a contraceptive pill or any other contraception, or you just stop having periods and you have some leftovers, please place them there. You don't know how you might help another person. And like Patrick said, ask your place of education or work to actually do something like that. Set it up yourself.
But on top of that, not just ask them to do something like that, ask them to do something like what we've just done and discuss with you and teach everyone, because I think it's... Because obviously there's lots of other issues that women face, and I think this is quite a good way to introduce people to it, because where it's a medical issue, people will, as it's scientific, people are gonna. Do you get what I mean? People are gonna listen to it, and then hopefully that could open their eyes to more female issues that are out there.
Yeah. And there's petitions that you can sign. There is the end. Let's stop period poverty that you can sign. Join the urgent call to give free sanitary pads to those that need it. And please visit the website The Homeless Period to find out more about that and how homeless women and homeless people, I should say, experience periods and all of that. And please join us next week for an episode on the environment.
Just before that, I'm thinking about what you just said, and I can't imagine how sort of scary it must be for a homeless person. Because obviously you don't have your own safe space quite often if you're homeless, and that's quite a dehumanizing sort of feeling. That because I couldn't. It's sort of like, I wouldn't want to change my boxers in public or like in a bush or something. So I can't imagine quite how painful that could be.
Yeah. So yeah, join us next week for an episode on the environment.
Yeah.